We've all been in situations where someone is trying to motivate us to perform better, do more, or to improve ourselves. Whether it be a parent telling us to be better, a teacher telling us to study harder, or a healthcare provider trying to convince us to change an unhealthy habit, we sometimes take the advice to heart and sometimes dismiss these attempts to change us. Books have been written and speeches given trying to motivate us to eat healthier, exercise more, or spend less. Much has been written about motivational theory and the components of effective strategies to change our habits, including healthcare. At a university, preparing students for careers taking care of patients, how can we prepare them to motivate their future patients to adopt lifestyle changes that will potentially improve their health? Welcome to Teach Well, Learn Well, a podcast series highlighting the scholarship being published by members of the University of Tennessee Health Science Center's community about effective ways to teach. I'm Tom Lochner of UTHSC's Teaching and Learning Center. Each month, we interview members of our faculty about their research and its impact in the higher education community. Today, we talked to Simran Flagg, Assistant Professor in the College of Dentistry, about a presentation she gave recently at the annual meeting of the Society for Simulation in Healthcare. She and Quan Xing, now at the University of Iowa, spoke about utilizing simulated patient methodology to teach motivational interviewing, dental hygiene undergraduate students' experience. Welcome, Simran.
Well, thank you for having me.
Can you talk about what motivational interviewing is and why it's important?
Well, when we have any type of communication with patients, we think about it as being a good listener, using prescriptive language and things like that. And most of it, people think of it as being common sense, right? How we talk to our patients and whatever our knowledge base is or wherever our approach is coming, medical, health, or any other way. Conversation should be easy. But when it comes to having them change the way they think or accept what you're saying or listening to your advice, sometimes we fall short. And motivational interviewing is something that can be used for that reason alone. So it is more of a patient-centered counseling approach. And it's usually designed for us to help individuals or motivate them, to change their behaviors. And it's usually in any setting, it is a conversation just like you and I are having right now.
So my experience with dental hygienists is the lecture I normally get about not flossing enough. And normally it doesn't work. So what you're suggesting maybe is that dental hygienist students are learning how to motivate their patients to do a better job flossing. Is that what we're talking about?
Yes, flossing is one big thing that we always hear, like, oh, whoever doesn't floss, yeah, like, I did floss, I was coming here, or I am here and you're going to floss me, right? So why do I need to floss? So that's just one of the topics that we encounter where we have to tell our students, don't harp on only one thing, but try to approach it in a way where you're giving them a positive feeling about how or where they are, to make a change for themselves. It's not just for flossing, but a lot of different things, because as healthcare providers, hygienists, they're not just tooth cleaners, that is a perception public has. But we are more than that. We are educators and we have a prescriptive authority, right? So it's not just advice, it's actually helping them living a healthier life. And to do that, you definitely have to understand where the patient is coming from, how they feel about certain things, what type of confidence or desire they have for change. And those things do count, and we don't pay attention to that. So especially when we are trying to teach or just reach out to our patient for any, for the conversation of making better, healthier habits, we have to remember those things. And so when we are training our students, we help them use this motivational interviewing concept so they can also learn how to communicate with their patient better so they can reach them better.
How has motivational interviewing been used in other disciplines?
When you think about it, and just like the word says, it's motivational. So you're motivating somebody for something. And interviewing is more of a conversation, like, how do you feel about this? What do you talk, where are you when it comes to your confidence in your ability to change? Or how or where is your desire? Is it a low desire to change or a high desire to change? So if you look at it, let's say some examples here. For us as healthcare providers, right, we talk to patients about having chronic diseases, such as being a diabetic or having hypertension. So those people, they might need to do some lifestyle changes, right? They have to exercise or eat healthier or do some things, where they don't get to do all the things that they desire, especially sweets or things like that. Same thing with teeth, right? You want to limit their intake of sugar. So those things come as a healthcare provider. Now let's look at another aspect of it. Let's talk about addiction, right? You're trying to support this individual to stop abusing alcohol or smoking cessation, right? We are trying to motivate somebody to quit smoking because it's so injurious to your health. The other is mental health. You have people with depression or some people with anxiety. We also see in our own dental practice, we can look at patients and we know who have eating disorders, and you want to help them, but you do not know how to approach them. So that's where motivational interviewing comes in handy, because you are using those tactics, using those tools, I should say, to help understand them and make them understand what their issue is, have them make the changes. So it doesn't feel like I'm lecturing you or advising you. Social workers use this also to help their clients make better changes, behavior modifications that they might do. In education now, we use motivational interviewing to maybe help them increase their performance or have a better professional and personal lifestyle themselves. So it can be used in various forms, in various scenarios.
That is certainly a wide range of disciplines that you discussed. Thank you for that answer. How did you come to identify motivational interviewing as something that was important for your discipline?
So one of the things that in hygiene we do teach in our classes, not just for prevention, but it's also used in different ways. Like I was teaching periodontology with one of the instructors, and the chapter that I had to cover was motivational interviewing. And just lecturing them or just talking about it, they were not receiving what I wanted to impart on them. So at that same time, I was taking some courses at TLC in our College of Dentistry. And they have, one of the things that they have is simulation, which really, I'm really excited when I do simulation and stuff, because it's acting out, enacting a real life scenario. And what a better, teacher than that, when you're put in that situation and you say, okay, now tell me how would you apply this? And motivational interviewing could be used in that, where in my case, we set up a whole case scenario. I met with professionals at TLC as a simulation center, and they helped me make a case where students had to engage with real life patients who are actors actually, and they're prepared what type of questions to ask, things like that. And they enacted and did a whole scenario where the patient was talking to my students as patient, or the actors did, and they had to come up with ways to make them change their behavior about going and getting help or getting treatment for periodontal disease, about making changes, behavior modification to the oral health care they have, things like that. So that's how it kind of all little things, tidbits got together, and it made into this big thing where I really got to use motivational interviewing in a teaching manner, at the same time also learning it myself and researching more about it. So it just kind of build on it, with little things here and there. So I would say that's how I happened to get into this motivational interviewing and researching about myself.
Well, thank you for the shout out to our simulation center. They have some wonderful people over there that just do incredible things. Talking about the study now that you did now, you asked students to self-report on their motivational interviewing competency. Do you believe that students are self-aware enough to report their own competencies? I'm thinking about sometimes whether I'm even self-aware of my own habits and the way that I do things. Are students self-aware enough to report on their motivational interviewing competency?
if you ask the students, you'll hear that, oh, definitely they know. They know all about it. They know how to talk to patients. They are self-aware. This is the age where all kids are so self-aware of different things about themselves and others. It's all about talking and feeling. So definitely, if you ask the students that, they will say that they are. But we have found that it's good to know how they look at themselves. How do they see themselves? The reason for that is if they self-evaluate it themselves, first of all, you get an insight into their head, like what are they trying to think, or where do they think they stand, right? Second, then you get to know exactly objectively where they might be underestimating or overestimating themselves. So you can help them, maybe guide them to become better. And so these type of assessment, to me, I feel like it helped me understand where they are. Also, what we did was we asked them to self-assess themselves before we did the simulation, and then they assess themselves after they did the simulation. So it's more like an eye-opening kind of thing. So you, again, as in motivational interview, you're making them realize where they need to work, what pitfalls they found about themselves, or what made them build their confidence more, like they can handle this when they are really talking to the patient. So this self-awareness that they get from questioning themselves or trying to provide insight for themselves, it's a two-way street. It's just helping you. It's also helping them understand themselves.
So in your presentation, you talk about the 5 areas of motivational interviewing theory. You talk about knowledge, analysis, synthesis, support, and communication approach. Can you talk a little bit about what each of those means?
Okay, so when we come to knowledge, let's talk about knowledge first. When you're training the students or they're learning about any topic, knowledge is something we impart on them or they gain through studying and things like that. So there's no new concept that comes about when you're doing a simulation or anything like that to teach them. So, the training may be reinforcing their knowledge, but it does not introduce any new concepts, so there's, that you can measure. So knowledge is just one thing that to let them know that, yes, I'm knowledgeable about this. I feel like I'm confident about this knowledge that I have. In our case was about periodontal disease or helping patient have a behavior modification, right? So knowledge, it didn't show much. It's just to make them self-aware that they have the knowledge already.
Okay.
What were the other things? Analysis part. Those, you do. It's like, okay, you have the interactive and the practical nature of the simulation exercises. So these are the exercises when they are getting a hands-on experience. So they get to apply all the theories they have learned and the real life scenarios that they have learned about. So they are actually improving on those skills and they're improving their ability to help the patients. Mm-hmm. And are they doing that effectively? So they get to analyze themselves a little bit more. And I get to analyze them. How are they learning? Is it being effective, what they are learning? So that's the analyzing part of it. When it comes to synthesis, what type of improvement are they getting? Are they integrating those motivational principles into their clinical practice? So are they synthesizing the knowledge that they have? Are they analyzing what they know? And how are they applying it? As far as the support is concerned, what type of improvement and reflective ability have they acquired? Are they being empathetic? Or are they being effective in patient support? So that would be the support part of it. And the most important one is the communication, right? The approach that they have. This one tends to show, we usually see improvement in this. And we want to see what type of engagement or interaction they're having with the patient. What style of communication they are using. Are they using open-ended questions? Are they being good listeners? Are they using any information that they have to help patient feel empowered. So communication and approach is a big one when it comes to motivational interviewing.
So you talked a little bit ago about the approach that you took in your study with the pre and post sort of effect. And it looked like there was significant difference in all 5 of those categories, except for knowledge. And the other ones showed pretty significant difference. Why do you think that knowledge didn't show a significant difference pre and post evaluation?
Because most of the students think that I already had the knowledge. I studied and I read the book, right? So once I do a simulation and I go through this whole enactment, knowledge did not increase. I didn't learn something that I didn't already know. We find that pretty common with students before and after simulation. So they feel like, oh, I knew this stuff. I know my stuff. And having that confidence, especially the younger generation tends to have that confidence, I know my stuff. I know what I'm talking about. So that's why I feel like there was not much significant difference in their knowledge before or after, which I was surprised because in my head, I'm thinking, you're more knowledgeable in understanding how to do these approaches. Yeah. Yes, you had the information before, but you did not have the knowledge to apply it. And that is what you're learning. So again, in their mind, they feel like they already know how and what they're doing. They don't need any improvement in that.
So it's almost like pre-survey, they gave themselves more knowledge that they really had. And then post-study, their knowledge caught up to where they thought that they were before.
Right. So there was not much difference there. They'd say like, yeah, I was knowledgeable before and after. I was knowledgeable. I feel good about
it. Say it another way. Pre-study, they were not as knowledgeable as what they thought they were. Then post-study, they were actually knowledgeable and were more accurate in how they were describing themselves.
Correct.
Yeah. Okay. I have teenagers like that.
Yeah, you go through that even with adults. I don't think it's just the kids. We all feel that way. Like, I know this stuff. I know what I got. Very few people will say, yes, my knowledge is limited. I need to learn more. And I think people who tend to say that my knowledge is limited, I want to learn more, are the ones who are the best educators and are also the best students because they're always learning.
So then on the other side of things, pre and post differences were strongest in terms of analysis and support. What happened that made that such a significant difference?
So once they were in there, in a scenario where they were put on a spot, right? You have to do this, now enact it. You already have the knowledge. Now let's enact this. So you have to use critical thinking. And then they suddenly realize, oh, I had to apply the critical thinking. I had to apply my evidence-based learning that I have learned, how to do these things with the patient. And I have to not just apply, but assess how the patient is doing it and also assess how I'm doing while I'm applying all these tools, right? Analysis really changes because they're like, oh, I can do this. I can talk to the patient and tell them what they need to do. But once they get into it and they have to think about it, okay, no, I'm supposed to be listening more. I'm supposed to understand that there might be resistance now. And if I am resisted by the patient, how will I efficiently communicate myself and understand where they're coming from so I can make those changes? So analysis completely changes, right? So they are now really getting to analyze themselves. And I think that's why you find such a difference between before and after.
How about support?
Okay, so the support is the strongest one, right? Because they didn't realize how much empathy and things like that can help them change the patient. And they watch others because in our simulation, they tend to also not just do themselves, but they're watching others talk. And when you see others do it, it's like almost like watching a movie, right? And when you watch a movie, you get a better understanding, more empathy, more sympathy on both sides, because you can be in a place where you're the patient or you can be in a place where you're a provider. And when you watch somebody else do that, your sense of reflection gets a little bit better. Your capability of understanding someone gets better. And so they are more effective in patient support. So that's where the changes comes about.
It's one thing to do this study and see what students are reporting as differences in their motivational interviewing techniques and strategies. Did faculty notice any differences throughout the study at the end of it, or did patients report any kind of differences in how they were being talked to by the students?
Now, that is the most interesting part, actually. You're absolutely right. Every time, every year, whenever, every semester that I do this motivational interviewing simulation, the actors, when they are done and they're giving their feedback, every single year, I find it amazing that they always return it and they say, we learned so much that we did not know ourselves about this, from the students. We learned so much. So that is something that, you never find out, like it, normally faculty feels like, oh, we know the stuff, but every day you learn so much from the students themselves, like their approach might be different. I had one of the students that explained to a patient about a pool table and the pockets that it has, and how pockets can get bacteria like the balls and stuff in
Oh,
them.
interesting.
And I mean, it was just amazing. And all the rest of the students watching them were like, that is amazing. That's a really great way of explaining. I'm going to use that. So faculty learns, from these scenarios, how each student can come up with different ways of explaining things and how they approach it. It's just fascinating. So I think we tend to learn ourselves the improvement and the enthusiasm and the learning that takes place, not just from doing it themselves, but also watching others do it. And the actors that are involved, they are learning too. So it's a great feeling when you leave that type of simulation, like everybody had a learning moment in there or learning something in there.
That's fantastic. I love that metaphor, the pool table and the and pockets. Now you've given your presentation. You're continuing to use these techniques to help your students with motivational interviewing. What's next? What are some unanswered questions that you have that you would like to dig deeper into?
So I want to know, how do the teaching methods differ, from a classroom to simulation? And I want to see doing like a smaller group, just doing a classroom teaching motivational, and then a simulation teaching motivational. And there's different type of simulation. You can have one-on-one with the student. Like in my case, when I do a simulation with the student, I use two students together as one provider, so they can support each other, right? This way they don't feel that they are alone. But it is on a Zoom. And I have another instructor who does the same thing with motivational interviewing, but she does it live. So they are doing chair side with a real live patient, right? They're still the actors, but it's different. So I want to explore those. How do the students feel when they do a Zoom motivational interviewing, or do they do a real case scenario where it's a live and they are one-on-one by themselves? So the difference between having support of another student taking over if you falter somewhere on Zoom, or if you're by yourself as a provider, but you're in a real life situation, one-on-one enactment in real situation and not over a computer. So that's one of the things that I want to explore. Also want to see if there are any long-term effects of this improved skills that students have. So once they graduate, I want to learn from them, how are they using it? How helpful was it to them to go through this type of learning or using motivational interviewing?
Do you suspect that there will be a difference between Zoom and in person as far as the interviewing goes?
Yes, because I've already, I do a little survey naturally after each class. I like to do my surveys and learn what my students think about it. And I've had few students who said that they felt better when they did one-on-one because it felt real to them. While I've had other students tell me that it felt better to be on the Zoom because then they had like a protective thing in front of them, right?
Oh,
They're
interesting.
not right there. So they didn't feel so intimidated when they were put on spot, because not everybody likes to be put on spot or be able to say things on a go, like, right now, right here, say it, do it. So test taking is not their big thing. And having that little screen in front of them, or having a fellow student holding their hand or being by them as a partner, was a comfort zone for them. So I feel like there's a lot more to explore there too.
Well, Simran, thank you so much for this time. Your study is very interesting, and anything we can do to help our healthcare providers be motivational is with their patients, I think, is amazing. And so it looks like I think you're doing some really interesting work, and I can't wait to hear more about it. Thank you
Thank
so
you
much.
so much. Thank you for having me. It was I love the fact that somebody's interested in things that we're doing here in our hygiene department. So I really appreciate it. As healthcare providers, that's the best feeling ever, knowing that what you're interested in, what you're learning or want people to learn, it's being heard and seen. So thank you for doing that.
And that is this month's episode of Teach Well, Learn Well. Thank you to Simran Flagg for her insight and study into motivational interviewing at the University of Tennessee Health Science Center. I'm Tom Lochner. Until next time, thank you.
And